Polycystic Ovary Syndrome, PCOS, is one of the most common endocrine disorders affecting women of reproductive age, with an estimated prevalence ranging from 6% to 12% globally. PCOS is a multifactorial condition, which means it involves a complex interaction between genetic, environmental, and hormonal factors. It is characterized by irregular menstrual cycles, excess androgen production, and the presence of multiple cysts in the ovaries, but it can manifest with a wide array of symptoms. Key features of PCOS: 1. Irregular menstrual cycles. Women with PCOS often experience irregular periods, which can be infrequent or absent altogether. The menstrual cycles may range from being highly irregular, less than 8 cycles per year, to prolonged periods, indicating anovulation, lack of ovulation. Excess androgen production. PCOS is marked by an overproduction of androgens, male hormones such as testosterone, by the ovaries and sometimes the adrenal glands. Elevated androgen levels lead to symptoms such as hirsutism, excess hair growth on the face, chest, or abdomen, acne and oily skin, male pattern baldness or thinning hair, acanthosis nigricans, dark, velvety patches of skin, often found in the neck or underarms. The ovaries in PCOS may appear enlarged and contain numerous small cysts, follicles, that do not fully mature. These cysts are typically about 2 to 9 millimeters in diameter and are often seen on an ultrasound. It's important to note that while the name suggests multiple cysts, not all women with PCOS have cysts, and having cysts alone is not sufficient for a diagnosis. Anovulation and infertility. A key feature of PCOS is anovulation, where the ovaries do not release an egg during the menstrual cycle. This can lead to infertility, which is one of the most significant concerns for women with PCOS. The absence of ovulation is often due to hormonal imbalances, particularly elevated levels of luteinizing hormone, LH, and insulin resistance. Insulin resistance is a common underlying issue in PCOS, affecting up to 70% of women with the condition. This means the body's cells do not respond properly to insulin, causing the pancreas to produce more insulin. High insulin levels can contribute to weight gain, obesity, and worsen other symptoms of PCOS. Insulin resistance also increases the risk of developing type 2 diabetes and metabolic syndrome. Metabolic syndrome is a cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. Obesity. Many women with PCOS are overweight or obese, though it is possible to have PCOS without being overweight. Increased risk for long-term health problems. Endometrial cancer, due to prolonged periods of unopposed estrogen without progesterone because of lack of ovulation, women with PCOS have an increased risk of endometrial hyperplasia, thickening of the uterine lining, and subsequently endometrial cancer if not managed properly. Cardiovascular disease. PCOS is associated with an increased risk of heart disease due to factors such as obesity, insulin resistance, and dyslipidemia, e.g., elevated LDL cholesterol, low HDL cholesterol, and high triglycerides. Sleep apnea. Women with PCOS, especially those who are overweight, may have a higher risk of sleep apnea, a condition where breathing repeatedly stops and starts during sleep. Mood disorders. There is a higher prevalence of anxiety, depression, and eating disorders among women with PCOS, partly due to hormonal imbalances, body image issues, and the challenges of managing the condition. Diagnosis of PCOS. PCOS is diagnosed based on a combination of clinical, biochemical, and ultrasound criteria. There is no single test for PCOS, but the Rotterdam criteria, 2003, are commonly used, which require at least 2 of the following 3 features. 1. Irregular ovulation, or anovulation, leading to irregular or absent menstrual cycles. 2. Clinical or biochemical signs of hyperandrogenism, e.g., hirsutism, acne, male pattern hair loss, elevated testosterone levels. 3. Polycystic ovaries on ultrasound, usually defined as having 12 or more follicles in each ovary, measuring 2 to 9 millimeters or increased ovarian volume. Exclusion of other conditions is essential, such as thyroid disorders, hyperprolactinemia, and other causes of hyperandrogenism, including non-classical adrenal hyperplasia and androgen-secreting tumors. The treatment of PCOS focuses on symptom management, restoring fertility, and preventing long-term complications. The approach varies based on the individual's age, symptoms, and whether they wish to become pregnant. Lifestyle modifications. Diet and exercise, regular physical activity, and a healthy diet can help manage symptoms, especially insulin resistance, obesity, and metabolic concerns. Weight loss, as little as 5 to 10% of body weight, can improve insulin sensitivity, regulate menstrual cycles, and enhance fertility. Low glycemic index, GI, diet, and balanced macronutrients are often recommended for managing insulin resistance. Psychosocial support. Women with PCOS may benefit from counseling or therapy, especially if they experience mood disorders, anxiety, or depression. Hormonal therapy. Oral contraceptives, birth control pills. Combined oral contraceptives, COCs, are often used to regulate menstrual cycles, reduce hirsutism and acne, and provide endometrial protection by inducing regular withdrawal bleeds. They work by lowering levels of androgens and controlling excess hair growth and acne. Progestins. For women who cannot or prefer not to take combined oral contraceptives, progestins, such as medroxyprogesterone, can be used to regulate periods, but they do not address other symptoms such as acne or hirsutism. Insulin sensitizers. Metformin, a medication primarily used to treat type 2 diabetes, is commonly prescribed to improve insulin sensitivity in women with PCOS. It may help with weight management, regulate periods, and improve fertility. Metformin can also lower the risk of developing diabetes and cardiovascular disease. Clomiphene citrate, Clomid. Clomiphene is the first-line treatment for women with PCOS who are struggling with infertility due to an ovulation. It works by stimulating ovulation and can help women conceive. Letrozole, an alternative to clomiphene, letrozole is an aromatase inhibitor that helps induce ovulation and is often used in women who do not respond to clomiphene. Gonadotropins. For those who do not respond to oral medications, injectable gonadotropins, FSH and LH, can stimulate the ovaries to produce eggs. In vitro fertilization, IVF. In cases where other fertility treatments fail, IVF may be recommended for women who wish to conceive. Antiandrogens. Medications like spironolactone block the effects of androgens and help reduce hirsutism and acne. These are often used in conjunction with oral contraceptives. Laser hair removal and electrolysis. For women with significant hirsutism, laser hair removal or electrolysis may be effective long-term options for reducing unwanted hair growth. Monitoring for diabetes. Due to the high risk of insulin resistance and type 2 diabetes, women with PCOS should be regularly screened for glucose intolerance or diabetes. Cardiovascular risk. Management of cardiovascular risk factors, such as elevated blood pressure, high cholesterol, and obesity, is critical to reducing the risk of heart disease. Lifestyle changes, statins, and antihypertensive drugs may be necessary. Women with PCOS may face emotional and psychological challenges such as low self-esteem, body image issues due to hirsutism and weight gain, and stress related to fertility struggles. Mental health support is important in managing the psychological aspects of PCOS. Polycystic Ovary Syndrome, PCOS, is a complex and multifaceted condition with diverse symptoms ranging from menstrual irregularities and infertility to metabolic and psychological issues. While there is no cure for PCOS, the condition can be effectively managed with a combination of lifestyle changes, hormonal therapy, and medical treatments tailored to the individual's specific needs. Early diagnosis, monitoring, and intervention are key to managing the short-term symptoms and preventing long-term health complications, including type 2 diabetes and cardiovascular disease.